Why would I have a campaign video made for an OSCA Executive Committee position? Let me tell you the real why. There was a man that was 29 years old, working for Champion Spark Plug Company, who severely hurt his back at work. He was unable to walk. His young son remembers seeing his father only able to use his arms to move himself across the kitchen floor. The father was told by a surgeon that he would have a 50-50 chance of walking if the surgery was performed. After that report, a neighbor came over to that little boy's house and carried the father to the family station wagon and drove the father to the chiropractor. The father was not pleased and screamed that he was not about to see a quack doctor, but he was not in much of a position to resist the neighbor's plan. To the father's amazement, he was able to stand after that appointment, and today at 72 years old, he has never had a back surgery. The father's son began seeing that same chiropractor for asthma. The son was a sickly child who missed 40 to 50 days of school per year due to the asthma. Would you believe that that boy stopped getting sick, was able to play sports again, and stopped having to go to the hospital and be put in an oxygen tent for several days, and was able to significantly decrease the medication required to treat the asthma? Today, that little boy is a grown man and needs only a rescue inhaler for when he is exposed to cats due to an allergy. Maybe you've guessed, but that little boy was me, and that 29-year-old man was my father. I personally have experienced chiropractic miracles in my own life, and that is why I believe that every individual should have the opportunity to see if chiropractic care can help them and their entire family. My name is Dr. Mickey Frame, and I decided to run for the office of Vice President of External Affairs on the Ohio State Chiropractic Association's Executive Committee. I choose to run for this office because of my passion for the profession of chiropractic. I hope to ensure that the state of Ohio continues to be one of the leading states to practice it. I want future generations of chiropractors to be successful in practice and to expand the education of the general public on the science and research supporting the profession of chiropractic. I have been an active member of the OSCA since graduating from Palmer College of Chiropractic in 1988. From 2010 to 2012, I was elected to the Executive Committee as the Vice President of Financial Affairs and served on the OSCA board for many years before as a district director and worked with many of the committees. I have been politically active over the years, meeting personally with various politicians and helping with fundraising events while contributing CPAC money to many others. I've been a leader in my greater Toledo area community by working as the official chiropractor for both the Marathon Classic and LPGA event and the Toledo Walleye hockey team. I have donated my time on multiple occasions for the Bike to the Bay, Race for the Cure, and served as board member to Make-A-Wish in Toledo to ensure chiropractic presence was felt. I returned to college and received my Bachelor's of Business Administration from the University of Toledo with a major in finance and a minor in business law in 2002. Upon completing my acupuncture certificate in 2010, I worked with Comprehensive Centers for Pain Management, where I offered chronic pain patients a drugless alternative while building support for chiropractic and acupuncture amongst our medical colleagues. As a leader in the Ohio State Chiropractic Association, I believe it is necessary to act in the best interests of the OSCA and fulfill our obligations to both current and future members. I believe a leader should always keep in mind that we must have the highest integrity as an association. I believe a leader should strive to enhance and maintain the reputation of the OSCA and embrace all chiropractic colleges and philosophies. I've been a strong advocate for my local OSCA district, and while on the executive committee or board, I was always asking critical thinking questions. I believe in the mission statement along with the Constitution and the bylaws of the OSCA. I believe the OSCA should develop a 1-year, 3-year, and 5-year plan or strategy, then work towards achieving those goals. I believe that metrics should be in place to obtain those goals, while keeping in mind that we must also have flexibility to participate in a dynamic healthcare system and environment. I believe that working to develop and mentor other leaders for future OSCA leadership positions is very necessary. I have a very strong belief in improving our political ties and contacts to position us as the drugless answer to Ohio's current prescription drug problem. I will continue to support, as I have in the past, the efforts to promote the Chiropractic Physician Status Bill.